Hey everybody, Dr. Roney here. The topic of this video is going to be bone and joint health. So I tell my patients, one thing that I feel really comfortable talking about is bone and joint health. As a chiropractor, as an athletic trainer, as someone who lives what I'm about to tell you and has seen great results. I think I'm pretty good at saying that you could trust the information. So when we talk about bone and joint health, the one thing that I want to articulate is that a lot of patients over the years have come to me and said, well, I have degeneration of this joint, or I have pain and aches and so forth in certain joints. And the doctors have told them that, well, it's just normal aging, right? The very first thing I want you to know is that that's not true, right? There's common joint aches and pains and things like that we see every day, but it's not normal, right? So I'll give you an example personally. When I was probably 25 or 30, I had somebody say to me, you want to look at the end. So go all the way to the end of life and look at how you want to be from a standpoint of, do you want to be upright? Do you want to be mobile? Do you want to be flexible? Do you want to be enjoying life because your body's allowing you to enjoy life? Does that make sense? And so what they said is that, okay, work backwards. Whatever you do today is going to allow that process to happen or not happen. So if I think, well, everybody degenerates and breaks down and they're frail and they're bent over and hunched over and they can't move as they age through life, right? If I believe that, that's what's going to be my reality. But that's not the truth, right? So I really want to articulate to you that there's common and normal, okay? Common is people as they age, break down, degenerate their bones, joints, etc. That's not normal though. So I think I've hit that point. So I just want you to understand it's common but not normal. Okay, so what do we do about it? So the process that I'm about to tell you is almost foolproof. It sways the odds in your favor or maximizes your chances significantly, and I will say I'm living proof. So here's the deal. Number one, we have to make sure that your structure is good, right? So structure dictates function of the joints and the bones, okay? So if I have poor posture, for example, if I have rounded shoulders and forward head carriage, as an example, I'm going to abnormally load certain muscles, tissues, and joints, discs, right? What have you. And just like a car out of alignment, when the alignment is out, certain parts of the tire are going to wear out prematurely, right? That makes sense. Well, it's no different. Your body, if it's in good structural position, is going to dissipate forces through your entire body, from the feet to the knees, ankles, knees, hips, and all the way up. And if I have good alignment and good structure, then I'm going to dissipate those forces evenly throughout a lifetime. Does that make sense? So again, structure is always going to dictate functions of the joints and the bones. So some of the things that you could have in your toolbox and spend money on, right? Invest in these things. Chiropractic care, good chiropractic care, a good chiropractor that understands that the muscles and the ligaments are what attach to that bone. So as an example, in my opinion, a good chiropractor, above and beyond just the adjusting, is going to teach you things like, okay, if my shoulders are rounded and my head is forward, right, which is going to limit the range of motion in my shoulders. It's going to limit the range of motion in my chest. It's going to cause my lungs not to expand well. It's going to cause abnormal tension in the back of my neck to those joints and the bones. If I understand that, the way that I'm going to change it is I'm going to stretch and strengthen. So if I want to change myself from this position to this position, I have to learn how to stretch everything through here, so I lengthen the tissue that inserts into those bones, and then strengthen the back part so I can be more upright. Okay, so a biomechanical specialist, a good chiropractor, a good massage therapist, a good trainer that understands structure and function of the body, you need to find that team to help you. I'm not saying you need to do it every day, but you need to do it consistently throughout a lifetime, right? So find those people, get them in your corner, and utilize them maybe once every couple weeks, once a month, something like that. Chiro, massage work, your workouts, I'll explain this, need to be geared towards what they call mobility, flexibility, and lengthening. They call that pliability of the tissues, okay? So, and I'll explain that in just a second. So that team is going to help you keep your structure in line so the forces are dissipated through the entire body, all your joints evenly. And when you have even distribution of force, your joints won't wear out prematurely. That's one aspect of this, right? So the other aspect, if there's an injury, you have to make sure that you do the rehab and get full range of motion back through that joint. If you have an injured shoulder, elbow, wrist, knee, whatever it might be, spine, motion is going to create the best healing to where you won't be subjected to degeneration in the future, okay? So all those things, the rehab part, the biomechanics, the chiropractic, the massage work is all critical to keeping your alignment right. The other part is stretching, right? So one of the things that happens, if my muscles get shorter and tighter, the joint that they're attached to or that they're helping move is going to have less motion. When you have less motion through any joint, your chances of becoming degenerative in that joint go way, way up. So you need full range of motion and you need full flexibility, pliability, and mobility through that joint in order for the bones and the joints to stay healthy, okay? So you've got structure dictating function, you have lengthening of the tissues that are probably physically two of the main components that are gonna keep your joints healthy, okay? Now, there's a whole other component to this, and that is what happens from the inside out, metabolically, okay? So one of the most common, other than poor structure, that causes bone and joint degeneration and pain and things like that is going to be inflammation, okay? So if I am eating poorly, if I have chronic infections, if I have poor gut health, if I'm not detoxing toxins properly, or I'm overloading my body with toxins, if I have too much stress, if I have hormonal imbalances, things like that, I'm going to be pouring water on my inflammatory fire. If I have a lot of inflammation in my body, my joints are going to degenerate because that inflammation affects, just spinal joints and shoulder joints and knee joints, especially the more weight-bearing joints it's going to affect. So keeping your inflammation low is really, in my opinion, I don't know if there's 1, 2, 3, but I'll call it 1A, 1B, 1C, right? 1A is keeping inflammation low in your body, and 1B, I would call it keeping your structure aligned, and probably 1C would be keeping flexibility, mobility, and pliability through the joints, right? So let's talk about inflammation briefly. There's a couple things, like I said, putting food into your body that has low inflammation, to me, is critical. We eat, most people, several times a day, every single day of our lives, right? So the one component that will raise inflammation in your body, affecting your bones and joints, is going to be what you eat. So I always promote a paleo-like eating plan that is farm to table. What I mean by that is, if I'm on a deserted island, what could I eat? Well, whatever the land offers. I could pick it or chase it. So I'm okay with meats. If you're not a meat eater, that's fine too. But I'm okay with meats as long as they are free roaming, free range, organic. You're not going to get the toxins and chemicals and additives and antibiotics and hormones and all that. It's going to be clean meat. And the cleaner the meat, the less inflammation it's going to create. So the idea, is good healthy fats, moderate protein, and low sugar, low carbohydrates, mostly in the form of vegetables and some fruits, right? If you're sticking to that concept, no breads, no grains, no dairy, no soy, not a lot of corn and some peanuts and things that are on the list of very inflammatory to the body, you're going to do well. Remember, just think what they used to do years ago. It's like they farmed it and then they ate it, whether they raised livestock or they had, certain carbohydrates available to them, fruits and vegetables. That's the concept that's going to win every day, all day long, as it relates to inflammation. So what you put into your body is significant. The other part that I'll tell you is what supplements that you take. So there's anti-inflammatory supplements that have been my go-to for years, and you've probably heard me talk about these before. Turmeric is up there, right? So about 1,500 milligrams of turmeric a day, about 250 milligrams of resveratrol a day. Those two combined are known to bring down what they call inflammatory cytokines significantly, right? So we're pouring water on that inflammatory fire. The third is vitamin D, which is probably one of the most important. Depending on the patient, at least 5,000 a day. Some people, if they're low, I put up to 10,000 a day. Glutathione, body's most powerful antioxidant, anti-inflammatory. Glutathione is critical for anti-inflammatory. That and vitamin D helps regulate, your immune system. And then there's many others, but omega-3s I think are very relevant as well. EPA, DHA are the fatty acids within the omega-3s. A 1-to-1 ratio of both of those is a very good anti-inflammatory to the body. And I would say, depending on how much inflammation, if you have a lot, go up to 2,000 or 3,000 milligrams a day. If you're just doing maintenance, maybe 1,500 milligrams a day would be okay. So those 5, turmeric, resveratrol, vitamin D, glutathione, and omega-3s are my go-to to keep inflammation down for my patients and what I do personally, okay? So the other things that you can start to look at are your gut health. If your digestive system is not doing well, if you have bloating or gas or irritability, there could be some overgrowth of yeast, there could be parasites, there could be SIBO, there could be things within your gut that need to get eradicated so you lessen the fuel to the fire, right? There could be, again, your liver could need a little bit of support to help eliminate toxins, etc. The other thing that I think is critical for bone and joint support are hormones, right? In this day and age, one of the mechanisms that I see is we have too much stress, we have a cortisol issue. In order for the body to keep up with cortisol, we steal hormones. And some of the hormones, one of them is progesterone, starts to get low, and we get estrogen dominance, and that sets up an inflammatory cycle in and of itself. But progesterone is one of the main hormones for bone building. It is responsible for what they call osteoblastic activity or bone building, right? So if I start to get hormonal imbalances, my joints are going to start to get thin, and that's called osteopenia. If they get too thin, it's called osteoporosis. So stressing the joint, right? There's a law in science called Wolff's Law. Bone remodels to stress. If I'm stressing my joints like squats and lunges and walking up and down steps, right, especially my lower half, those bones are going to remodel to that stress. That's a good thing. Now, if I have poor structure and I have bad stress, the bone's going to remodel to that, which means you're going to get abnormal bone laid down. We don't want that. So structure, obviously big key, but then stressing the joints and the bones are going to be good for bone rebuilding and remodeling. The hormone progesterone is one of the main factors, and I have to tell you, over the years, I do a full, for most people, cortisol panel, DHEA panel, pregnenolone, and all the sex hormones. Most people that I work with, especially women, have this stress response going on, and they have lower than normal levels of progesterone. And that creates a problem with being able to build bone consistently. So then osteoporosis potentially is a factor, okay? So, I mean, look, we could probably go on, but what I will tell you, and I want to use me as an example, when I learned that at 30, I started to put all these things in place, right? At 51, I have literally zero joint pain ever. I go to the gym, I work on all these things that I talked about. And then if I go out, say I go out and play a football game on Thanksgiving, we'll be playing a football game with my nieces and nephews. And they're all college athletes, a lot of them. I hang with them, I run with them. There's nothing that I've lost over the last 25 years. In fact, I'll even say I'm significantly better based on applying all those concepts than I was at 25. I can move better, I'm more agile, I have better range of motion, all those things. And my joints, I know, will never be degenerative because of the process that I've just explained. So that process works really well, and I'm living proof of it. So again, take the steps. Structure dictates function. Get people in your corner to help you with that, whoever that might be. If you need help, I'll be happy to help you. Get on the right supplements. Make sure the hormones are balanced. Make sure the fuels to the fire are down. And make sure the supplements that you're taking are anti-inflammatory. It seems like a lot, but I do this stuff every day, and it's just part of my routine. And in my brain, I know I'm investing in those things because I want to, at the end of this journey, I want to look just like I do today. Now, I understand there'll be aging, but I want my joints in my body to work extremely well the way they're supposed to all the way till the end, so I have great quality of life. It's all about this process, and implementing it, that's going to allow you to get there. Okay? I know it's a lot. Hopefully that helped. If you need anything, definitely reach out. I'll be happy to help you with these steps. Okay, have a good day, everybody.